Baltimore City is partnering with a taxpayer-funded nonprofit to provide a vending machine where people can get drug paraphernalia and Narcan, which saves lives.
Spotlight on Maryland's Patrick Hoff investigates the city's plan to expand drug harm reduction services.
Harm reduction focuses on minimizing the spread of disease and overdose deaths from drug use. It's an approach that's gaining steam in Baltimore. We took a look at one of the latest city initiatives, a vending machine stocked with drug paraphernalia.
The Baltimore City Health Department partnered with Charm City Care Connection in East Baltimore to launch a harm reduction vending machine that was installed in October. The machine provides needles, safer sex kits, fentanyl tests, naloxone, and more. Users can access the machine for free 24/7 after creating an account through a Google form that asks your gender identity, race, and year of birth. A painting on the machine states, "You don't have to get clean. You were never dirty."
You have to be willing to say, actually, drugs are bad.
That's Charles Lehman, a fellow at the Manhattan Institute who studies crime and drug policy. He said a harm reduction vending machine may send a confusing message to the surrounding community.
Slapping down a vending machine in the middle of where people are not using drugs, isn't doing much at the margin except A, imposing cost, and B, sending a signal, however minor, to the people around you and the people around the vending machine that this is the sort of behavior that the government tacitly condones.
Baltimore City won nearly $700 million in settlements and jury awards last year in its lawsuit against pharmaceutical manufacturers in response to the opioid crisis. Mayor Brandon Scott announced that $20 million of the funds would be given to the Baltimore City Health Department, which will help launch a division of overdose prevention and harm reduction. Another $5 million went to Charm City Care Connection. Lehman said some harm reduction services like clean needles and overdose medication can benefit the community, but must be paired with a sincere effort to treat addiction.
Harm reduction is kind of a Band-Aid that you're putting on a gaping wound. And it's not necessarily going to hurt the wound to put a Band-Aid on, but it's not going to do very much.
A spokesman from Mayor Scott's office told Spotlight on Maryland, quote, "The vending machine is a part of a larger effort to reduce harm, promote health, and provide resources to any community member needing them. Conflating harm reduction with encouraging illegal drug use is a harmful misrepresentation that stigmatizes life-saving public health strategies."
A spokesman for Charm City Care Connection told Spotlight on Maryland that the harm reduction vending machine benefits the community because it expands their services to 24/7 access. You can read more about his comments on our website. We'll have more in the coming days about whether research shows if harm reduction services prove to be effective. For Spotlight on Maryland, I'm Patrick Huff.
I'm Mary Bubala. Thank you for watching. Here's another video for you to watch. Also take some time to subscribe to our YouTube channel.